Team brief this month comes from Heartlands Hospital and Ward 15, which is the paediatric assessment unit. And soon I'm going to be meeting the matron here, Amy Denier, and then the ward clerk, Salim Shahid, and asking them a few questions about the ward. Now, to start with, I want to talk about staff engagement. And take a look at this interesting infographic here. You may remember that before I started the work here, I wrote to 2,000 members of staff and asked for their views. And I got lots and lots of responses. And they've now been analysed into themes, and that's what's shown here. And of course, one of the things that you'll instantly see is there's a lot more don't likes than there are likes, and that's what we're trying to fix. Continuing on the theme of engagement, we've been doing a lot of stuff at the level of the whole trust, but we're now moving on to individual teams. And you can see from this list here the first 9 teams that are going to go through the engagement process. And we're looking for expressions of interest for a second cohort. So if your department wants to get involved, this is how to get in touch. Events continue over the next 2 months, and you can see here a list of 5 events that are going to be happening and how to sign up for them. And of course, we want to know how this is all working. So we've just completed our first staff opinion survey, which has gone to around 25% of all staff. And we're going to do this 4 times a year, so individually you'll get asked your opinion once a year. Another major piece of work has been done on refining the values of the organisation, and over 1,500 of you have taken part in a process to produce a list of just 4, so here are now the 4 values that we're thinking should be the main ones for the Trust. And finally, it's the time of year where we start inviting you to nominate people for the Staff Recognition Awards, and here's the address to go to download a nomination form. Now moving on to quality. And one of the biggest safety concerns we have in the Trust is about the A&E departments and congestion. So I'm pleased to say that we've now agreed a plan to relocate minors at Heartlands. That will mean that we can convert that space to extra majors and more room for resus, which will tackle one of the biggest problems we face. As you probably also know, we've started a policy where we draw patients out of the medical admissions units and put them onto the wards in order to create flow through A&E. Also, we've just identified the first cohort for our Quality Champions programme, and we've signed up to the National Patient Safety Campaign. So those are 3 quite big moves on improving quality in the organisation. So how is the Trust performing? Well, here are some charts and figures that show you how we're doing after the first month of the year. First of all, financially, you can see here that it's not been the greatest start to the year because we've made a £2.7 million loss in the first month, which is somewhat worse than we were expected. But if you look at infection control, and here is the MRSA chart, we're continuing the great performance of last year, where we had just 1 case in the whole of last year and none so far this year. And if you look at C. diff, again, a really good start to the year, just 2 cases so far. The total number of serious harms we've got for the month comprises no never events, 2 hospital-acquired pressure ulcers, 10 serious falls, no MRSA, 2 C. diff, 3 MSSA and 9 E. coli. So that gives a total of 26 for the month, and that's something that we're going to report on routinely and monitor our progress. Turning then to our A&E performance, we remain very, very challenged as a Trust. As you can see here, 2 of our sites well below the average. But as you can see from this chart, we're not alone in the West Midlands in having serious challenges in achieving the A&E target. And it's not really the greatest thing to rejoice in, but we're not the worst performing organisation around. And now to round up with a number of different news items. First of all, the building works at Solihull Hospital on the new dermatology suite are progressing well, and that's expected to open in August of this year. Secondly, one of the suggestions from the listening events was that we run a shuttle bus from the staff car park to the overflow, and we've done a trial on this which hasn't actually been very successful because there wasn't much take-up. But we're going to repeat the trial in the winter months when take-up is likely to be higher. Good news for fans of green developments. We're installing new lighting and solar panels on all 3 hospitals at present. And good news for people who want extended opening hours. On the Heartlands site, the Cafe 1 is now going to stay open till 6 o'clock serving food, and the Costa is going to be open from 7 o'clock in the morning. So we're going to be trialling these extended hours for about 8 weeks to see how popular they are. On the important issue of surgical reconfiguration, we've been advised that there has to go through some processes with NHS England and the Clinical Senate during the summer, so the formal public consultation will start in September. And finally, an exciting piece of news. One of our clinicians, Steve Smith, formed the view that the NHS gets so much knocking in the media that it would be nice to do something to show how much people like the NHS. And he came up with the idea of Hug a Hospital. So we'd like to invite you to come along to Solihull Hospital at 2 o'clock in the afternoon on the 5th of July, where we're going to try and form a giant human chain around the hospital to give it a hug. And at the same time, we're going to ask people to donate £1 to charity. So that will be a really worthwhile event, and I hope you can come along to it. I'm with matron Amy Denyer from Ward 15 and Salim Shahid, who is the ward clerk here, and I'm going to ask them a few questions about what it's like to work on this unit. So first of all, Salim, can I ask you, why did you invite me to come here and do the filming here?
I thought it would be a good idea for you to see how the ward works and let you know what the new developments are and what we are achieving and how we are running.
Amy, you've worked here for 15 years. Tell me, what are the main things that happen on this ward?
Okay, so we provide nursing and medical care for children that have got general healthcare needs and who come in who are acutely ill. And we also care for a big group of patients that have chronic illnesses.
And what are the main problems and pressures that you face?
We're currently undergoing quite a lot of change within the directorate regarding paediatrics. So it's an unrestful time for staff and for our community and patients, but we are working very closely to keep everybody engaged so they're aware of why we're doing what we're doing and providing best care for the children that we see.
And what are you most proud of?
I can't tell you one thing that I'm proud of. I'm proud of so many things. However, I'm proud of the team that work for paediatrics and their dedication to the children and the families that we see.
So, thanks. Now, Salim, you've met some interesting celebrities. Tell me who you've actually met.
I've met Peter Andre, Lenny Henry, because I work at the NEC and I see him coming out at particular shows.
And secondly, who is it that every year brings a bit of magic to the children's ward here?
It's our play team who organises events that are going on, and also they have quite good links with the Birmingham City Football Club, which they invite them to attend and meet the children.
And finally, which nurse on this unit has won the Pride of Birmingham Nursing Award?
It's Julie Rowland. She's won the Nursing Pride Award in Birmingham.
Thank you very much. And that's the end of this month's Team Brief.